Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 update for today, October 15th, 2020. I want to start by acknowledging with gratitude that we are on the traditional territories of the Lekwungen-speaking peoples, the Songhees and Esquimalt First Nations, and they are the traditional keepers of this land. Today, we have 142 new cases of COVID-19 that have been diagnosed, including 3 epidemiologically linked cases, bringing our total number of cases in British Columbia to 11,034. That includes 3,974 in the Vancouver Coastal Health Region, 5,800 in the Fraser Health Region, 239 people in the Vancouver Island Health Region, 587 people in the Interior Health Region, 345 people in the Northern Health Region, and 89 people who generally reside outside of Canada. We now have 1,494 active cases in the province in all health authorities, of whom 74 are currently in hospital, 24 of whom are in ICU or critical care. We have no new deaths to report, leaving the total number of people who have died from COVID-19 in British Columbia to 250. There were 3,683 people now who are on active public health follow-up, and 9,257 people who are recovered. For the 142 cases, there were 9,016 laboratory tests processed yesterday, giving us a percent positive rate of about 1.5%. There are no new healthcare outbreaks to report today. 19 active outbreaks in our healthcare system continue, including, 17 of which are in long-term care or assisted living and 2 in acute care facilities. We now have 921 cases in our healthcare system, including 533 residents and 388 staff. We have 1 new community cluster to report today in the Interior Health Region at the FedEx office near the airport. Public health teams are on site and are working with the business there, and contact tracing is underway. There is no risk to those in the public who are picking up packages, and there's contact tracing underway right now. And in addition, please check with each of the health authority websites about other community exposures. Oh, excuse me. Got something in my throat today. So today, as part of our ongoing provincial monitoring for COVID-19, health teams have been paying careful attention, as you know, to children who might be hospitalized with what has become a new syndrome that is sometimes associated with COVID-19, and that is the multisystem inflammatory syndrome in children, or MISC as it's known. And we have been following this for some time. Initially, we were only reporting confirmed cases, but in the summer, we changed our monitoring to report cases under investigation to be aligned with both the Canadian and the WHO case definitions, and to make sure that we could monitor all of the children who might have been affected by this. We have had 16 children who have been under investigation. None of them have had any positive laboratory tests that would indicate they were associated with COVID. And today we did have 1 child, our first confirmed case of MISC here in British Columbia. This is a young child under age 5 who has been diagnosed with MISC once their serology test came back positive for COVID-19 this week. The child has fully recovered and is now at home. And to date, we, as I mentioned, have had 16 children who have been assessed for MISC but have not had any association with COVID-19, and are, in the assessment of the pediatricians, much more aligned with what we normally see with Kawasaki syndrome in children. Again, also a relatively new syndrome that's associated with infectious illness in some cases, and it's, we think, though we're not entirely sure what the cause of it is, both MISC and Kawasaki syndrome are associated with inflammatory processes that happen in the body, particularly the blood vessels, after a person has been infected with viruses in many cases. And we will continue our ongoing monitoring of any child who's hospitalized with the symptoms that meet the case definition, and our pediatricians at Children's and Women's Hospital have been an incredibly team of experts who've been supporting children and parents around the province to make sure that we have this, that we understand what is happening here with this. So today as well is International Hand Washing Day. So I do want to take advantage of that to remind people that the simple act of cleaning our hands can make a big difference in our lives, making sure that we are protecting each other and ourselves from COVID-19, but also for many other illnesses, everything from the things that cause stomach upset to influenza. And this is our time to remind people that take a moment to refresh your good hand washing techniques and habits. Make sure you wash your hands when you come home after you've been outside, if you've been touching things like on transit or in the school, cleaning your hands before you eat, before you touch things and put them in your mouth, making sure that you're not touching your face are important as well. And soap and water is the simplest way to wash your hands, and we need to do it for 20 seconds. It works by mechanical action, so making sure that you use the soap, you get your hands wet, you lather them up, and then you wash them and rinse them under running water, warm running water. For those, for times when soap and water is not available or a sink is not available, alcohol-based hand sanitizers can take that place, particularly if your hands are not visibly soiled, and they get rid of those transient bacteria and viruses that we can pick up by touching things in the community. So remember, wash your hands for at least 20 seconds with soap and water and dry them thoroughly. And if soap and water is not available, then alcohol-based hand sanitizers can stand in. Another important preventive measure for everyone is, especially this year, is to ensure that everyone gets the influenza vaccine. Vaccine supplies are starting to come in here in BC now, and we've started to distribute them around the province. I want to reassure everybody we have sufficient vaccine supplies. There's been no problems that we've identified with the supply that's coming in. The supply chains are strong, and there have been no delays in the manufacture of the vaccine this year, so that's good news for all of us. The optimal time to be immunized is in the coming weeks. So if it takes a week or two for you to get an appointment with your pharmacist or your physician or at your public health clinic, the best time to do it is end of October and into November, and that's where we get the maximum protection through influenza season. So I want to reassure everybody that the supplies are coming into BC and are being distributed around the province and will be in the coming weeks. We also monitor very carefully for influenza and do this every year here in BC and across Canada. And the influenza, so far, rates have been very low in our community. So we're not yet into that season. So we have time to make sure that everybody who wants it can be immunized in the next few weeks. And so monitoring influenza, it's still low, and we want to keep it that way. And we keep it that way by doing these important protective measures like cleaning our hands regularly and being immunized for influenza. So as we know, everyone in BC has a role to play in our COVID BC response, and no more so than as we move into this respiratory season. What you do helps everyone around you as well. And these simple steps, like washing your hands regularly, getting our influenza vaccine, can make all the difference to us, our families, and our communities across BC. So please do your part today to help protect our communities this fall and winter. And of course, we need to continue to do this, to care for each other, to connect with each other, even as we take those measures that keep us physically apart, and continue to be kind to each other, to be calm and understand that this part of the storm can be challenging for many, and we need to do our own bit to be safe. Thank you very much, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to one question and one follow-up. Please also take your phones off mute. You will not be audible until your name is called. First question today is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. Today I met a 31-year-old Vancouver woman who was on a ventilator with COVID for 16 days in September and nearly died. We know a lot of young people are getting COVID right now, but can you tell me how many other similarly aged young people are having serious outcomes like that?
Yeah, and we do hear about this, of course, and the recovery from even milder illness for some people, the recovery can take a long time. We, of course, are really happy that this young woman has survived. If we look at the data that we have on the dashboard at the BC CDC, it lets us know, the number of people who are infected, how many in each age group have been hospitalized, and we've thankfully had nobody who's died under the age of 40. There have been 3 or 4 in the 40 to 50 age group, but we know the more severe illness goes up as we get older. But we are not immune to severe illness and these very stressful and trying and long-lasting impacts for people who have to be in hospital, and particularly if you required mechanical ventilation. So, yeah, thank you for bringing this up and reminding us that we are not immune ourselves from having these types of illnesses, but also we can bring it home to our families and to elders who may not have that same robust response to recover from something like COVID-19.
Shannon, do you have a follow-up?
Yeah, this woman told me that like most people her age and her friend group, she did not take COVID all that seriously. She told me she felt she was invincible, and if she got it, she would be okay. Do you think her telling her story could help get that message through? If young people see another young person who suffered greatly tell their story, that maybe that will get through?
We do encourage people to share their stories. We have to balance what we know in that most young people will not have long-lasting effects from this. Most of them, thankfully, will not end up in hospital or in ICU. But it's hard to tell ahead of time who is, and you may not know who in your friend group are people that have an underlying illness that's going to mean that this virus can have more severe effects in them. So it is incredibly important for us all to take those measures to protect each other and to protect those people that we are close to, whatever age they are. And we report today on our first confirmed case of this multi-system inflammatory syndrome in children. And this is also a very severe illness. We know that children are much less likely to be infected with COVID and to have very mild symptoms. But we can't always tell who is going to have these severe outcomes. So it is important that all of us bear that in mind. We are still learning about this virus. We do not yet know if there are going to be long-term effects, even for people who have mild illness. So it is a cautionary tale that all of us need to pay attention to.
Next question is from April Lawrence, Check News.
Oh, hi. Thank you, Dr. Henry. I just wanted to touch on the flu vaccines a little bit more. Parents of young children can't get their kids vaccinated at most pharmacies and have to go through doctors or public health units. But here in Island Health, the public clinics not only aren't open yet, they aren't even taking appointments yet. I realize that it is still early in the season compared to previous years, but wouldn't there have been a benefit to having them open earlier than usual this particular year?
Well, we try and time the clinics with when the vaccine comes in. And as you know, we get different vaccines in different amounts in the weeks leading up to the end of October. So this is generally the time when we start our public immunization program. So end of October and into November, and middle of November into December. We are thankfully having very low rates of influenza circulating right now, and we expect that to be the same for the next couple of weeks. So yes, every health authority is planning on making sure that they have clinics. We have to do it slightly differently in the time of COVID, making sure that we don't have people congregating together, that we can keep people safely apart. And I know there's some very strategies that are being worked on by clinicians in physicians' offices and by public health for those public clinics. And they will be opening in the coming weeks, as our vaccine supplies come in. We're focusing to start with, of course, on long-term care homes and making sure we can provide immunization to those most at risk in care homes and healthcare workers, and those programs are starting now as well, and you will be seeing much more about this in the next few weeks.
Do you have a follow-up, April?
Yeah, just briefly on that. I guess, so what would your message be? Because we're also hearing from some vulnerable seniors who can't even make appointments and are spending their time calling and showing up in lineups and, so eager because of the pandemic to get this vaccine this year. What would you say to them to sort of ease that anxiety as they sort of wait to even get an appointment for a flu shot?
Yeah, that the vaccine is coming. We know we have lots of it, and it's being distributed around the province. So make that appointment. Call your family physician. Call if you have one. Call the clinic. Call the public health unit. Go to Immunize BC. There's a influenza tracker that can tell you where influenza clinics are happening in your area. And so that's bccdc.ca and type in influenza tracker, and you can get information about where you can get to your appointment. So an appointment in a week or 2 weeks is just fine. And I would encourage people that that's the optimal time to be immunized, because then we know that the immunity that you get from the vaccine will carry you through the influenza season.
Next question is from Claudia Van Emmerich, Global Okanagan.
Hi, Dr. Henry. I know that you've touched on this before, but I'm hoping you can elaborate a little bit today. It's to do with Halloween, and with the occasion fast approaching, there are a lot of parents trying to decide what to do about trick-or-treating. Do they take their children? Do they skip it this year? Do they only go to a few homes, or maybe only visit family members' homes? I'd like to know what your advice is for those parents as they're really grappling with this issue.
Yeah, and we've been hearing about that across the country. And, we did talk about this a week and a half ago. We have some good information for parents and for communities on the BC CDC website again, bccdc.ca, and it has events and Halloween. We have some really specific things in there. So what I would say is it depends a little bit on your own situation in your community. So keep it local, keep it small. Keep small groups. And if you do want to have that trick-or-treating experience for children, very small groups, look at your neighborhood, do something in your own community. If that's not going to work, or if you have a community where people aren't into that, then we need to respect that too. And this may be a time, there's lots of great things we can do with having small family Halloween hunts in our house, and rather than going out or watching a movie instead of trick-or-treating. So I think there are lots of options, and some of them are up on the options that we provide on the BC CDC website. I think we have to be mindful as well that some of those communities where the whole street would get involved, or a whole building would get involved, or in the mall where they had indoor events, those are not going to be recommended this year. We want to keep things small with your small group, but there is ways, if there's a street or a part of your community that wants to get involved, to have outdoor small numbers with things pre-packaged for kids. But I think there's lots of great ways that we can do it just with our own family, and the idea of going to close family or the people that are in your community bubble and keeping it small this year is going to be really important.
Claudia, do you have a follow-up? Oh, sorry. Go ahead, Claudia.
Along the same lines of advice, but perhaps this time to the people who typically hand out candy, I imagine that many of them may decide to skip it this year, not to hand out the candy to reduce any chance of getting ill. What is your recommendation to those people? Should people avoid it, or can this be done in a safe manner, and if so, how?
Yeah, I think everything can be done in a safe manner. We know a lot about what are the things that make things safe. So we don't want kids to be digging in a bowl. We don't want to bring them into the house. So if you're going to have candy, set it up outside. Find a place where you can put a table out and have individual packages that children can pick up. Or I saw some really innovative things. There was some people using a hockey stick, which is of course very Canadian, or a slide tube into a children's bucket bucket. So I think there's lots of things that we can do to keep those distances. It's making sure that we're keeping our distances. Outside is better than inside. Small groups. So if children are going trick-or-treating, then they need to be one or two, not the group of 10 or 15 like may have happened. And we really don't want people crowding together. So if parents are going with their kids, keep it small. Make sure it's just your bubble, and don't have it outdoors rather than inside. And pre-packaged in single packages so that there's not a lot of mixing and touching. And of course, the really important thing on International Hand Washing Day is to make sure that we clean our hands before we open anything, after touching things, before we eat any of the candy.
Next question is from Zara Premji, CBC.
Oh, hi, Dr. Bonnie Henry. Well, first off, I should say Happy International Hand Washing Day. My question for you is, if BC adds into the daily totals all the private tests done by industry, Phil Malone is estimating about 32,000 a week. So wouldn't that skew the provincial positivity rate, especially if all those tests are preventative?
Yeah, so it's unclear to me. Some of those are included. There has been a change in what has been included, and in some cases they are and some are not. So we have been looking at that, and yes, the positivity rate in those is quite low, of course, because most of those tests are done in asymptomatic people. But when we take out the ones that we believe are associated with those, and I have to say, the challenge that we have, and we've said this a few times, is we have many different platforms that are being used, and it's sometimes difficult for them to talk to each other from an IT perspective. So we're not entirely clear which ones are the ones from specific industry, for example. Some of them are industries like some of our industrial sites, or some of the processing plants where we've had a case and other people have been tested. So it's a mixture. But yes, we do monitor those, and even without that section, those pieces of the lab, most of them are done through, the data comes in through Life Labs. Even without those, we do monitor our testing rates as well, and we do remain low here across the province, with certain exceptions. As we can see, we still have a high proportion of our cases are in the Fraser Health region. And one of the things that are important, as we've talked about before, the daily case rates are the number of people who have tested positive today, but it doesn't reflect when they might have been exposed and when their illness may have started. And it is much more, when we look at it, we look at that epidemic curve by date of onset of illness, and that's available in the BC CDC dashboard. And we look at the rate of infectious, the percent positive over time. So a moving average over a week is much more representative of what we're seeing across the province.
Do you have a follow-up, Zara?
Yes, thank you. So, Dr. Henry, why do data analysts believe that BC has stopped sharing how many health workers are testing positive? So if this is shared with Public Health Canada, if not, why not? And is this not crucial information given this whole call for radical transparency?
We have not stopped sharing that. That information is provided. We collect that information as part of the case report forms, and it is information that is collected at the BC CDC. We've not been reporting on it on an ongoing basis. It takes some time to do the analysis, but we do provide that information, and certainly provide it on request. One of the things that we've been doing nationally is revising our case definitions and focusing some of the surveillance on what are the important things we want to collect more detailed data on. And as you can imagine, in our federation, that's not always a simple process. But we have recently agreed on case definitions for important occupational groups like healthcare workers. So it has changed slightly from what we were reporting before. But we're also looking at disaggregated data by race, and how do we collect that information going forward as well. And those changes have happened over the past few weeks, but we've certainly reported on healthcare worker data and some of our data and modeling updates, and we can certainly do that again.
Next question is from Rob Buffum, CTV Vancouver Island.
Oh, hi, Dr. Henry. Thanks for taking my question. I know you've spoken a fair bit today about the fact that there will be sufficient vaccine supplies coming. I guess I'm wondering, as I spoke to various pharmacies in the Victoria area today who said they are all out of the first dose they had. Some of them have ordered many more times than they typically do. So I'm wondering if you can explain for me what's the point in having that first dose come out when it does now if it's not as effective as getting it later? And do I understand correctly, we're not actually in flu season yet, although people's kids may be getting sick with colds or bugs at this time?
Yeah, so we monitor for influenza in similar ways that we use that surveillance system that we have for influenza to help us understand COVID early on as well. And we're not seeing a lot of influenza circulating right now yet in the province. There's no perfect time to get the influenza vaccine. And as our stores come in through the ordering that we've done over many months ago, in February is when we had to put the orders in, they come in over time and we distribute them around the province. So yes, there'll be more coming this week and more next week. So it does take some time early on, and the demand has been very high early on. But the optimal time to get immunized is over the next few weeks. So between doing it right now and doing it a week from now or 2 weeks from now, those are all times that'll be fine. And especially, that we're not seeing a lot of influenza, so the risk isn't here right now.
Rob, do you have a follow-up?
I do. I'm just wondering if you can explain for me, in terms of people's options, if you want to get it, as I say, if you call a pharmacy in Victoria now, the best you'll likely get is put on a wait list. Do I understand correctly, you could go through a pharmacy and perhaps get in there in a week or two when more comes in, or go through your GP or through public clinics that provide flu shots, in the coming week or two or whenever that starts happening?
Yes, so there are many options that we will have available again this year. So health authorities, the public health clinics will be running flu clinics. There'll be immunization options through pharmacists, and in the last few years, pharmacists have delivered a good proportion of influenza vaccine in the community. We know that physicians' offices also deliver vaccine, and they are looking at ways of doing that to be very efficient this year as well. So there will be public mass immunization clinics, as we call them, through public health that are being scheduled for the coming weeks, as well as immunization through physicians' offices and through pharmacists. And I would encourage people to go to immunizebc.ca, and that's there's a flu tracker where you can find out what pharmacists, what clinics are happening in your area, and that's a good way to find out what's coming up in your area.
Ashley Wadwani, Black Press.
Hi, Dr. Henry. Are you able to confirm how many suspected cases of MISC there have been in BC? If I recall correctly, I think it was back in August you mentioned we'd start reporting suspected cases or recording them.
That's right. We call them persons under investigation, and back in August we had 8. We're up to 16 now, suspected or people under investigation for MISC. None of them are believed to be MISC, and they've all been, none of them have tested positive for COVID. So the only one today is our first confirmed case here in the province.
Do you have a follow-up, Ashley?
I do. I'm sorry, I know you've talked about MISC before, but 2020 has been a little long, to say the least. So I'm hoping you could break down again what the concerns are when it comes to this syndrome, and are you concerned about BC seeing its first case most recently?
Yeah, no, this is something that is has been associated. We first heard about it back in April. With children out of Italy and in New York City, and there were small numbers of children, some of whom had antibodies or had tested positive for COVID. So there was a worldwide effort to see if we can quantify this and understand it. And it was a syndrome. When we call it a syndrome, that means there's a bunch of different things that can happen, and it's a combination of them that fits you into this criteria. So a syndrome is something when we don't know exactly what's causing it or what what's causing it, or you could have a constellation of things that might lead to your belief. So the definition that we've got, which is what we're using now in BC and around the world, is children and adolescents, so 0 to 19 years of age, requiring hospitalization. So one of the key things is having a fever, a prolonged fever, a fever that won't go away for at least 3 days. And as you can imagine, that's not an uncommon phenomenon. And at least 2 of the following. So the things that we're seeing with this that are slightly different from Kawasaki syndrome, we're seeing some children have gastrointestinal, so stomach, abdominal pain, things like vomiting or diarrhea. A rash is quite common, usually on both sides of the body, and it has to do with inflammation of the small blood vessels under the skin. What we call non-purulent conjunctivitis, so that's red eyes, inflammation around the eyes, and often inflammation and swelling around the mouth as well, and the hands and feet in some children. Because this virus, COVID-19, and other viruses can also attack the blood vessels, it can lead to what we call hypotension, so relaxing of the blood vessels or leakiness in the blood vessels that can cause them to stretch and expand, or cause inflammation around the heart and around some of the blood vessels. And the other part of it is sometimes blood clotting can be associated with it. So those are things that we also see with post-infectious syndromes from other viruses, but also what's called Kawasaki disease. And there's a number of blood tests that are associated with it as well. And what we know is that we rule out other causes that can lead to this type of a syndrome, including a bacterial infection, which sometimes happens, and so no other obvious cause of it. And a confirmed case is somebody who has that syndrome in a child that also tests positive, either by the NAT test, the nasopharyngeal test, or by a serology test. And that's been more common in the cases that we've seen around the world, because this is a syndrome that tends to come up several weeks to months after an infection. And so all of the other kids, the young people that had it, that were in hospital here in BC, the 16 others, none of them had any tests that were positive for COVID, and were likely, according to their clinicians, much more likely to be associated with some other cause. And then this is the first time that we've had a child who actually has tested positive by serology, which means they had an infection in the past.
Next question is from Brishdi Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. According to the statement released yesterday, the number of people hospitalized with COVID was 84, and today you mentioned that it's 74. I was wondering if you know what accounts for the discrepancy there.
And good news, people were discharged from hospital. So yes, we had a decrease of 10 people in hospital over the last 24 hours. Sometimes it takes a bit of time for the data to catch up. As you know, there's hospitals around the province. The majority of them were people who were discharged from hospital in Vancouver Coastal.
Brishdi, do you have a follow-up?
No, that's all. Thank you.
Thank you. Next question is from Craig Takuchi, Georgia Strait.
Hi, Dr. Henry. I just want to ask, how much of a risk is there of transmission in some situations that teachers have told me about in schools, such as their inability to prevent physical distancing, and students touching each other, everything from roughhousing to hand-holding, cohorts intermingling during breaks, and the inability to hold staggered breaks because of limited supervision. What can teachers do if they feel that their unions or WorkSafe BC is not doing anything about these issues, even though they're reporting them? And how much of a risk of transmission is there?
Yeah, so, risk in schools, as we know, is related to risk in our communities. And we've seen a number of exposure events where we have not seen almost all of them, we've not seen transmission within the school setting. So that tells us that the risk in the school setting is still quite low. And it is reflection of what's happening in our community. So the things that we have in place, the many different pieces that are in place to try and protect all the people who are in the school setting, so reducing the numbers of people, making sure parents aren't coming, making sure that they're not coming in and out, the keeping children as much as possible to their same cohorts, their same groups, are all the things, including the cleaning, the washing our hands, the ventilation, the trying to keep groups separate. So these are all things that need to be worked out on a class-by-class and school basis. And teachers need to work with their school community to make sure that they have the things in place that they need within their classroom and their environment. And there are many different ways that people are doing that in different schools. So I would encourage them to talk with their principal, to talk with the superintendent and the school boards to make sure that things are done as they need in each individual school.
Craig, do you have a follow-up?
Yes, thank you. Would you have any advice for special education assistants who have to physically work close to their students who have diverse needs or special needs, but who may spread their bodily fluids inappropriately, such as spitting or drooling, intentionally coughing? And also, these assistants, they move from classroom to classroom or between cohorts throughout the day to attend to the various students. And is that a transmission threat at all?
You know, these are not new things. We know that there are people who work with special needs children in the school environment every year, and there are always concerns about health and safety and how to manage that. So each individual child and their assistant needs to have a plan for how they're going to manage things. And yes, we do have plans in place for every classroom, every school, to make sure that risk of transmission is minimized. And really key, of course, is that we want to make sure that anybody who's ill, whether it's a staff person, a teacher, a student, stays out of the classroom and make sure they get assessed if needed. So those are all the things. There's layers of protection in place in the school. So there's no one thing that is going to make the difference. And each special needs child and their assistants needs to have a plan for how they're going to manage these.
We have one more question this afternoon for everyone listening. Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca for medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca, and for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Sandy Hall, CFAX 1070. Sandy, are you there?
Can you hear me?
Yeah.
Yeah? Okay. I'd like to ask, a lot of people out there ride the bus, as I do, and I'm noticing an awful lot of people getting on the bus that apparently has mandatory masks, and they immediately put them under their chin when they get on or under their nose. And I'm wondering what kind of message you might put out about that, because it's really hard to social distance on a bus.
It is, and you know, we are all learning. We're all learning how to live with things like masks and physical distancing and hand cleaning. But yes, we need to learn how to wear a mask properly, and that is something that we remind people with the posters that we have. And it needs to cover, for a mask to be effective to protect you as well as protecting others, it needs to cover your mouth and nose. So any of your excretions that you breathe in and expel get caught in the fabric of the mask. So it is important to not fiddle with them and to keep them covering your face, your mouth and nose, particularly when you're in those enclosed environments. There are also making sure that you clean your hands after you leave the bus before you eat, things like that will be helpful as well.
Sandy, do you have a follow-up?
Just one. I'm wondering, right now it does say mandatory masks, but they're really kind of mandatory-ish. A lot of people are getting on the bus without masks. And as we've heard you say before, it's kind of rare that you would have a medical condition precluding a mask. So do we need to get tougher?
Yeah, you know, I've been talking to Transit, and they've provided stats, and it really shows that the vast majority of people are doing the right thing. and we need to remind people sometimes, and that's the job that that transit is taking. They're doing it in an educational way, making sure that things are up there, reminding people the posters are up there about how to wear them and how to do it safely. And we need to remember that most people are doing the right thing, and we need to make allowances that we don't always know somebody's story, and it may not always be obvious why they are not wearing a mask. But it also is important for us all to do our bit, and it is when we cannot maintain those distances, and transit is the perfect example of that. It's all of us need to do our bit by wearing our mask and wearing it properly when we're in those situations.
That's all for today. Thank you for joining us.
Thank you very much.